Today, we're going to talk about phlebotomy and common blood tests. So some of the first things we're going to look at is some usual common blood tests. And the first one we have is blood culture. A blood culture is a test for the presence of bacterial or fungal pathogens in the blood. And you should also note that oftentimes patients will show up at a physician's office or emergency room complaining of just feeling what we call malaise or not feeling normal or like themselves. They have fever, they are weak, they're tired, they just want to lay around. So the first thing the physician is going to order is a blood culture lab so that we can see what's growing in the blood. And typically, this will let us know if there's any bacterial or fungal pathogens that are in the blood that could be causing the patient to feel malaise or tired or just weak and don't want to do their normal activities. Another term I want you to really be familiar with is iatrogenic anemia. Iatrogenic anemia. It's a type of anemia caused by excessive removal of a patient's blood. For example, what will happen when a person is drawing too much blood, maybe from an infant. So we really have to be careful as to how many tubes are we filling, and we definitely want to use the pediatric size tubes when we are doing their labs. So iatrogenic anemia is caused by excessive removal of patient's blood. Jaundice, that yellowish tint that you see sometimes in patients who have problems with their liver. Well, here it is. Jaundice is an excess of bilirubin in the blood. You'll see this in patients who have cirrhosis of the liver or any type of liver problem. So every time you see that, they'll have yellowish in their eyes and their sclera. They'll have yellowish skin tint. It's really quite discerning when you see that person because you know their skin color is not normal. I want you to also be familiar with coagulation. Coagulation is the process of blood clotting. If you see anything, any kind of word that has coag on it at all, you need to know that it has to do with blood clotting. So some of the common duties that you'll see with a medical assistant or a phlebotomist initially in terms of blood draws, collecting blood specimens for analysis as a part of your job, performing venipunctures or the puncture of a vein, performing capillary puncture or the puncture of the skin to collect blood from capillaries, fingertip or heel. So please note that you will collect blood from venipunctures, that's going through the vein. But you will also collect blood from puncturing the finger, usually the third middle finger. In an infant, you'll collect blood from their heel, and that's also through capillary, also what we call dermal. So reasons why blood tests are typically ordered may be as a part of a routine medical care. Oftentimes, elderly people who see the physician on a regular basis, they've got the patients on a schedule for when blood is supposed to be drawn so they can check their labs, check their status. It could be to aid in a diagnosis. Maybe a patient, they may suspect that something's going on with the patient, and in order to give a final diagnosis, they need to draw blood. It may also be done to monitor a specific medication. Some medications, um, they have what we call toxic levels, or your body can build up a tolerance to that medication. So periodically, you have to draw labs to find out how strong or weak is that medication present in an individual's body. So we may draw labs for medication, for treatment, or for a condition. Now, here are some common blood tests that are ran. I want you to be familiar with BMP. BMP, which stands for Basic Metabolic Panel. Oftentimes, the physician will write on the requisition form to do a BMP. You need to know what tests fall under that BMP, and not only that, you need to know what their ranges are. For glucose, you want to make sure the patient was fasting, and that simply means fasting from at least midnight until the time of the test from the night before. And a fasting glucose, the normal range should be 70 to 99 milligrams per deciliter, is how you would read that. Calcium, 8.6 to 10.2 milligrams per deciliter. Sodium, the normal range is 136 to 145 milliequivalents per deciliter. Potassium, 3.5 to 5.0 milliequivalents per deciliter. Carbon dioxide, 23 to 28 milliequivalents per liter. Fluoride, 98 to 106 milliequivalents per liter. Blood urea nitrogen, the normal range, also called BUN, the normal range should be 8 to 20 milligrams per deciliter. Okay, creatinine for the female should be 0.50 to 1.10 milligrams per deciliter, and then for male, 0.70 to 1.30 milligrams per deciliter. And these are the tests that fall under a BMP or a basic metabolic panel. Another test that a physician might order is a CMP, and all that stands for is comprehensive metabolic panel. So the comprehensive, we're looking at more tests. It will be everything that's under the BMP, and now these additional tests that test the liver as well. So for a CMP, all tests for the BMP, and then these tests such as the albumin, 3.5 to 5.5 grams per deciliter, total protein, 5.5 to 9.0 grams per deciliter, the alkaline phosphatase, or ALP, 30 to 120 units per liter, alanine aminotransferase, ALT, from 10 to 40 units per liter, aspartate, aminotransferase, or AST, from 10 to 40 units per liter as well. And then your total bilirubin, 0.3 to 1.0 milligrams per deciliter. And it's not a bad idea to understand these numbers. I haven't seen them really test you on the numbers for the liver. All of the tests from albumin to total bilirubin are all tests that tell us what's happening with the liver primarily. And I haven't seen them ask you the numbers, but it doesn't hurt to know the numbers. I'm not going to ask you for the labs under the CMP or under the last liver enzyme tests, but I will for the BMP. So you need to know the BMP values, the ranges. A lipid panel, anytime you see the term lipid, think fats, think cholesterol, think the stuff that's in your blood vessels. So a lipid panel, this is what we're going to be looking at under a lipid panel. Total cholesterol, high density or HDL, low density lipoprotein or LDL, and your triglycerides. What I want you to know is that your total cholesterol should be less than 200. That's what we're shooting for. Your HDL, less than 50 milligrams per deciliter. I'm not so much going to ask you about the ranges for the HDL, but I do want you to know that we want the total cholesterol less than 200, and that all of these things fall under the lipid panel. Total cholesterol, high density lipoprotein or HDL, LDL, and triglycerides. Okay. Another common blood test that physicians may order is a CBC, which stands for complete blood count. White blood cell count, I do want you to know that the range is from 4,000 to 11,000 microliters. Red blood cell count falls under CBC, hemoglobin, hematocrit, and the platelet count. You will need to know the range for the white blood cell count. I haven't seen anyone ask you specifically about any of the other lab values, ranges, but I want you to know, I want you to recognize that white blood cell count, red blood cell count, hemoglobin, hematocrit, and platelet count all fall under CBC. So there are types of tests that are typically performed on capillary specimens. When we say capillary, we're referring to tests that are done at the bedside. Capillary means sticking through the skin, like through the finger, the third finger, or through the heel. And these are all typically tests that are done at the bedside. Tests that are done at the bedside, like you walk up to the patient's bed, just let them know who you are and what you're there for. Those are typically called point of care tests when it comes to drawing labs. So many point of care tests, most commonly, here are they: glucose monitoring, your PT, which stands for partial thromboplastin. You'll learn about that later, but just know right now, just know about PT and it relates to blood clotting times. You should also know that for patients taking warfarin, warfarin is the oral version of a blood thinner. It's like a pill that patients are prescribed by their physician to help with thinning their blood. It's a blood thinner. So it's the pill version of a blood thinner. And the reason I'm sharing that it's a pill version, because later you're going to learn about the liquid version of a blood thinner. You may have heard of people giving themselves shots in their stomach to thin their blood. Well, that's the liquid version of the blood thinner. It's called heparin. So back to the point of care test. You have glucose monitoring, you have PT measurements, you have hemoglobin and hematocrit, and you have hemoglobin A1C. Your hemoglobin A1C, also called the HbA1c, is a test that measures patients' blood glucose level for the past 3 months. You should know that. The hemoglobin A1C is a test that measures the patient's blood glucose level over the past 3 months. Peripheral blood smears are also tests that can be done at the bedside, and those are to examine the shapes of blood cells. And all of these are done with capillary specimens. Now, here are some patients for whom venipunctures are not suitable for, may routinely have blood specimens collected by capillary punctures. So typically, we primarily, especially if we have to have, 4 or 5 milliliters of blood for a lab, you definitely need to get it from the vein. But there are some times when the patients, you just having difficulty getting the blood from a vein, and you may have to try to get the blood from a capillary out of their finger, pricking their fingers. Here are the patients who sometimes their veins aren't suitable. It may be an obese patient. It may be a patient who's been burned, heavily scarred, and cannot be reached. Patients with a history of blood clots in the vein. Patients whose veins may be used only for specialized treatments, such as chemotherapy. These are our cancer patients. Patients whose veins are very fragile or damaged. Patients whose veins are hard to puncture. Patient for whom iatrogenic anemia, remember that's when you remove excessive, you've already removed excessive amount of blood from, and that's a concern. So that may be a person that you're not able to get blood from the vein, you're having to get it from the capillary. It may also be an infant 6 months of age or weighing less than 10 kilograms or 22 pounds. That may be, these are all people who you may have problems getting venipunctures from, and you have to do it through a capillary. Capillary puncture is not suitable collection methods for these types of tests. So we just said that sometimes you'll find cases where the patient has situations and you can't get it from their vein, you got to get it from their capillary. Well, now we're saying here are some specific tests that you cannot draw the blood through capillary for. Erythrocyte sedimentation rate. This is a type of test. It's also called the ESR. You need to make sure you note that. The ESR, it requires too much blood, so you can't get it. You can't run this test from a capillary collection. There's various collection studies, coagulation studies that you can't get from a capillary. And any test or set of tests that requires more than a milliliter of blood is best collected venipuncture, and you can't do that test from a capillary specimen. Okay? Fasting. You need to know this term. Fasting means in medicine the requirement to not eat or drink anything but water. Now, you can have water, for a specified amount of time, usually 8 to 12 hours before a test or a procedure. Now, some of the importance of avoiding errors before and during specimen collection. So, by performing phlebotomy tasks carefully, the MAs or phlebotomists play an important role in promoting patient health and well-being. So, a medical assistant's action have a significant impact on the quality of a specimen. If the specimens are not collected properly, results may not be accurate. So when specimens are compromised, the provider makes decisions based on the inaccurate information, and that could be a major, major malpractice. Mistakes in patient or specimen identification can cause dangerous or deadly errors. High quality specimens allow patients to get the best care. So you want to make sure you keep that in mind. These are something that we call pre-analytical errors. Pre-analytical errors. When an inaccurate patient specimen identification has occurred. So maybe, for example, you went to a patient's room, but you did not identify and make sure that that was the right patient that you're supposed to be drawing blood on, and now you have results back on the wrong patient. You have good results, but it's on the wrong patient. That's a pre-analytical error. Most common identifiers used for CLSI standard are asking the patient to state and spell their first and last names and state their date of birth. Information must be checked against the patient's wristband if one is used and against the requisition form and specimen labels. So make sure you check your patient's identification. Other mistakes in creating or reading requisition forms could be manual requisition forms may be hard to read, so that puts you at risk of making an error. Requisition must list the ordering provider. Yes, when you look at that patient's requisition, and you guys will see a sample soon, make sure it has the ordering provider's name on it. If anything is unclear, the medical assistant or the phlebotomist should contact the ordering provider before proceeding. You do have that authority, you do have that right. You can call whoever the ordering doctor is to clarify, did they actually, what is this particular lab that appears that they have ordered before you actually go to do that lab. Some sources of pre-analytical errors can be mistakes in patient preparation, such as you should have confirmed that all instructions. You want to confirm that all instructions have been followed correctly. You want to make sure that patients were, if it's a test that they were supposed to be fasting, that they really were fasting. So those are things that you need to check before you draw, like cholesterol or any type of test where the patient was supposed to be fasting. Some tests require that a specific medication has been either withheld for a period of time. So you would need to ask them if you're trying to draw patients some tests that determines what their blood thinning level is, like PT and PTT. You want to find out did you abstain from certain medications prior to drawing particular labs. Needles and collection equipment must be selected to match the patient in the test. So you can't use a needle that's way too big for the person you're actually drawing the blood on, because it will change the way the blood comes out. The blood may come out more clotted. So you have to use the appropriate size needle gauge, and we'll talk about that more later. But I just want you to recognize that right now. The correct tubes must be used for the test that's ordered. Specimens must be properly mixed with tube additives. Some sources of pre-analytical errors can be tubes can be collected in the right order. Tubes must be collected in the right order so additives do not interfere with each other. Tubes must be filled to the right level in order for additives to work correctly. Correct technique must be used, and specimens must be handled, processed, and transported correctly. All of those are very important. A needle gauge. A gauge is a measurement of the size of a needle. Higher gauge numbers correspond to thinner needles. A syringe, of course, is a tubular device with a plunger that, when pulled, acts to draw in fluid. For example, blood. That's a syringe. Here is a picture of an evacuated tube system. You'll notice you have your collection tube on one end. That's the actual tube that you guys will be working with. Then you have the plastic flange, a holder. And then the other part, you have the needle to puncture the tube stopper. That little, it looks like just like a pointed area, but it actually has a needle on the inside and the rubbery part on the outside. And then you have the hub, which is the little yellow thing there, and your protective device, your shaft, and your bevel. All of these are part of the evacuated tube. So we're going to stop there to watch a short video.
Guys, so today we're going to be doing a phlebotomy lesson on a real live patient. So first of all, I already have my supplies here. In real life, I would check her arm first to see which needle I need, because of course, if they have a small fragile vein, if we're doing a pediatric geriatric patient, we would use a butterfly. But in this case, I'm doing a lesson on straight needle on Vacutainer system. Okay, so we're going to go ahead and get started. Now I'm going to put my tourniquet on. In real life, you want to check both arms and you want to go for whichever arm is the best. But I already know I'm going to go here. Now, if you look at her arm, she has a beautiful vein. Like, this is the type of person that when they come in the lab, you are very happy because it's a very good vein, right? Everybody is not going to be like that. But in this case, she has a very good vein. So I'm going to tie the tourniquet on. And as you guys know, you want to tie the tourniquet 3 to 4 inches above the elbow, depending on how big your hand is or how big your fingers is. That's maybe about 2 to 3 fingers. So we're going to tie that there. I do have a video on how to tie the tourniquet. So here, I'm not going to get into that. I'm just going to go ahead and tie it on there. So I've already verified her name and date of birth and made sure it was okay for me to do this, right? So I have the tourniquet on. I'm just going to have her make a fist. Now, I'm not going to have her pump, because if you pump, that can alter the results. So we're going to actually just have her make a fist there. And as you can see, once she made that fist, her vein became even more prominent, okay? So I'm going to feel that there. And the way we feel for a vein, we want to palpate, right? We're not going to be feeling like this. We're going to palpate just like that. And the vein is actually spongy. It kind of bounces right back at you. All right, so once I find her vein, because this tourniquet should not be on for more than a minute, we're going to go ahead and release it, or as we say, pop the tourniquet. All right, I'm going to go ahead and clean it. And when we clean, we want to clean from the inside out, circular motion. Wherever you're going to stick, you want to just wipe there and then keep working your way out, okay? All right, so while that's drying, I'm going to go ahead and get my supplies together. So I'm going to assemble my needle there. Put that there. I'm going to open up my Band-Aid because we want everything all ready together. We don't want to stick our patient and then have to do all of this. We want to have everything already ready. All right, so I'm going to put that there. Now my dirty stuff, I'm just going to kind of put that to the side because I don't want it all to get mixed in, right? Just going to put that over there. Okay. All right, I got my gauze here. Now, this is very important. When you are doing phlebotomy, you're going to have a needle inside your patient's arm. You don't want to be moving that needle and all over the place. So whatever hand you're going to be sticking with, just remember your supplies are going to be next to the opposite hand, okay? Because once you stick that patient, your hand can never move. The only hand that should be moving is your opposite hand, okay? So in my case, I'm right-handed. I'm going to stick with my right hand. So I'm going to make sure all of my supplies is on the left side. Scoot up for me a little bit. Sure. All right. So now I got everything ready. Also, another thing too, I usually sit my tubes in the order of draw, in the order that I'm going to pick them up, right? So if you know the order draw, you know that this light blue is going to go first. Now, I'm just going to draw the light blue, but I just wanted to put 2 tubes right here to show an example. If you're doing multiple tubes, just go ahead and sit them in the order you're going to draw them. That way, it's easier to just pick them up and keep going, okay? All right, so I'm going to go ahead and put her tourniquet on. We don't want to put the tourniquet on until we are ready to stick, okay? So this is the last thing I'm going to do right before I stick. Alrighty, make a fist for me. And then can you take this fist and put it right up under your elbow? Right there, yep. Alrighty, so I already cleaned it. Now I'm gonna take my cap off and I'm gonna hold her arm right here and I'm gonna taunt the skin. Taunting the skin also allows us to anchor the vein so the vein does not move, okay? So I'm just gonna go here, my bevel is up. So I'm gonna go in there. I'm only gonna draw this one tube. Now the blood is flowing, so go ahead and open up your hand. We want to pop that tourniquet. Remember, tourniquet tube, needle. Okay, so we're going to remove that tube. Alrighty, notice I use my flange. Alright, and then I'm going to have her apply pressure. Lock your needle or activate the safety device as soon as you come out, okay? You don't want to stick yourself. So we're going to lock right away, and then we're going to put it in the shock container, okay? Now, can you apply pressure for a moment? Sure. I'm going to have you kind of lift your arm up and apply pressure. Now, while your patient is applying pressure, because you want to continue to apply pressure and allow it to stop bleeding before you apply the Band-Aid, right? So I'm going to have, while she's applying pressure, that's when I'm going to go ahead and label my tube with her name, date of birth, my initials, the date, as well as the time, okay? And depending on where you work, you may have a label for your tubes, okay? So once I do that, I'm going to label my tubes, and then I am going to give her a Band-Aid. One thing that I want to point out when I was drawing her blood, as I was drawing her blood, my hand was steady, right? So as I was drawing her blood, I was using my phalanges. In my phlebotomy video that I did before, I talked about the importance of using your phalanges, right? So when you're going in, you want to hold your flange like this, coming out, you want to press against it, because what happens is if you don't do that, as you're pulling the tube out, it's going to pull the needle out as well. So in order to keep that needle from coming out, you want to press on your flange. So again, we want to go in and hold our flange, coming out. We want to press against it either with our index finger or your thumb, either way, okay? One thing too I want to mention, remember the tubes have additives in it, so we have to invert it. So normally when I'm drawing blood, as I am sitting my tube down, I normally just invert it a few times as I sit it down, and then I'll go back and invert it 8 to 10 times or 5 times, depending on the tube, because each tube has a certain amount of times it needs to be inverted. Alrighty guys, so that's that.
Okay, so back to looking at our evacuated tube systems and how they're used to collect most specimens by venipuncture. Your double-sided needle with a built-in protective device. One side of the needle punctures the patient's vein and the other punctures the stoppers of collection tubes. You'll see this in labs when you go over to do some lab training. You'll see the double-sided needles. You also have multi-sample needles because it can be used to collect multiple tubes with a single venipuncture. The bevel of the needle is sharp, angled opening that pierces the patient's skin. Needle length usually ranges from 1 to 1.5 inches. Needles are categorized by their diameter, which is their width or their gauge. Higher gauge equals thinner needle. The hollow space inside the needle is called the lumen. So remember, this is the evacuated tube systems that are used to collect most specimens by venipuncture. So I was just talking about that and didn't realize you guys couldn't see the screen. Okay. Now, the evacuated tube systems, if a needle is not pre-assembled with the holder, it will have a threaded hub. And I know some of this is going to sound Greek to you initially, but once you get to the lab to see this in action, you'll recognize it. You should also have examples of this in your book. Shorter needles used to pierce the top. The tube stoppers is encased in a rubber sheath to prevent accidental needle sticks. Needle screws into a rigid plastic tube holder with a flange that makes it easier to push tubes into the correct position. Collection tubes are emptied of air during the manufacturing process so that they can draw in exactly the right amount of blood. So you should have saw that on the video we just watched. So you want to make sure that you know that the most commonly used needle gauge size for venipunctures in adults is the 21 gauge. You need to know that. 22 to 23 gauge needles may be used in patients with smaller or fragile veins or in a pediatric draw. The 25 gauge needles may also be used for pediatric draws. And we're talking about those numbers, we're talking about the needle sizes. The hubs of needles are color coded to indicate the gauge. So you should know the color coding used where you work. Now, here are some facts about winged and winged collection sets. Commonly called butterfly needles, are usually shorter than a straight multi-sample needle, 3/4 to 1 inch. They have a smaller flap at the base of the needle, allowing the phlebotomist or medical assistant to guide the needle as it is inserted into the patient's vein. It does not connect directly to the tube holder. Wing collection. You'll get a chance to see that in lab. It has a flexible tubing on the wing collection set, which allows you to change collection tubes without placing pressure on the patient's vein or skin. Butterfly needles also come in different gauges. Most common gauge is 21 to 23, but also sometimes 25 can also be considered one of the gauges that they use most often. Often used when drawing blood from patients with small or fragile veins. So those are some of the sizes that you may see, your winged collection. So we typically use the wing collection butterfly needle for elderly patients and infants, but you can use them on regular adults and regular children as well. So with the wing collection, it's also used when drawing blood from the back of the hand. Blood cultures are routinely performed using butterfly assembly. Butterfly needles can be attached to a syringe for syringe draws, sometimes used when a patient's veins are too fragile to take the pressure created by the evacuated tubes. Should not be the first or standard choice for blood draws associated with a higher number of accidental needle sticks. Okay, and you'll get a chance to see and actually work with a winged infusion blood collection system. So here are some facts about evacuated tubes. Tubes come in a variety of sizes. Typical volume of tubes used for adults is 3 to 5 milliliters. Typical volume of tubes used for pediatric patients is 1 to 2 milliliters. Larger evacuated tubes create a stronger pull on the patient's veins, and you need to know that. Pediatric tubes are smaller to reduce pressure on the veins, and because they should have lower volumes of blood draw. So smaller tubes may also be needed for patients who are elderly or ill, for example, patients undergoing chemotherapy, and patients who are in the hospital and have blood drawn frequently may also require smaller tubes to avoid the excessive removal of blood, also called iatrogenic anemia, that could develop. Here are some other facts about syringe and syringe transfer devices. A syringe is a barrel-shaped device with a plunger that is pulled to draw in blood. A standard multi-sample needle or commonly weaned collection set is attached to the syringe. So most MAs or phlebotomies collect blood by gently pulling back on the plunger. The needle is removed or discarded by a safe transfer device. Step-by-step procedure is found in your Learning Objective 8, and you'll see this in your book as well. So the following equipment that is also required for blood draws: gloves, you're going to need antiseptic solution, you're going to need a tourniquet, you're going to need gauze, there it is, a gauze, and bandage. And you saw that in your video. Sometimes you're going to need, especially when you're drawing blood from infants and if you're drawing through capillary on their foot, the heel, you're going to need a warming pack. And even sometimes for veins, it'll make the veins more prominent. You may also need an electronic device if you have a person who has a difficult time with you finding their vein. You might need an electronic device, or venoscope can help assist with vein locations. With capillary punctures, they require things such as gloves, antiseptic pads, gauze, and bandages. But capillary collection tubes are not emptied of air and hold a smaller volume of blood, usually between 125 to 600 microliters. So tubes may be called micro collection tubes for capillary punctures. Blood is sometimes collected in tiny capillary tubes that are sealed with clay. These tubes are color-coded to indicate whether they are treated with the anticoagulant heparin or not. Heparin, remember, is like a type of blood thinner. So the equipment for capillary puncture collection, such as lancets. Lancets contain a small retractable blade or needle. Depending on the type of lancet used, the MA or medical or phlebotomist either presses a button or pushes the lancet. And this is kind that we use for checking blood sugar. All lancets are typically disposable or single uses. The depth range from 0.85 millimeters for premature infants to 2.4 milliliters. The range of 1.8 milliliters to 2.2 milliliters is recommended for adults. You should know that. I've seen that on your test. And 2 millimeters is the maximum puncture depth for children. You need to know that as well. Warming packs, as we mentioned earlier, can help improve blood flow. Special filter paper is required for certain types of tests. Test script. Okay, so test strips may be required for some point of care testing, such as glucose or your PT, which measures blood clotting. On that special filter paper, that is required for certain types of tests on newborns. Just wanted to go back and emphasize that. You should know that serum is the liquid portion of the blood. And when we talk about order of draw, we're talking about the standard sequence in which collection tubes are filled during a blood draw. And you're going to see a couple of videos on order of draw as well. Now, here's some other additional facts that you need to be aware of when collecting blood. You need to be aware that some tubes actually have additives in the tube themselves. So using the correct additive ensures that the analytes for each test are prepared properly. Most electronic systems print tube labels that indicate the type of tube required. Tube stoppers are color-coded to indicate the additive inside. Manufacturers' tube labels indicate the additive in the tube and also list an expiration date. Listen, when you're preparing to draw blood, you want to make sure your tubes are not outdated. That could hinder that could be like an analytical error, pre-analytical error that could cause problems with the test results. Always check your tube expiration dates. And also make sure that the blood goes to the fill line on the tube. That's like a little line of where how much blood should have been collected in that tube. Some tests must be performed on whole blood, which means the blood should not be allowed to clot. These specimens are collected in tubes containing anticoagulants. Different anticoagulants act in different ways, so specific anticoagulants may be required for certain tests. So some tests are performed on blood serum, which means the blood must be allowed to clot. All tubes need to be mixed gently. Remember, we do our inversion. Tubes may have a separator gel that forms a barrier between liquids and solids after centrifugation. Now, you need to know that centrifugation means a spinning in a machine that separates the blood components. You should have pictures of all of this in your textbook. Your tan top tubes contain EDTA but are certified lead-free. They are used to test lead levels. Other specialty tubes may be used to test for trace elements in the blood, but if a test requires a tube the medical assistant or phlebotomist is not familiar with, you can confirm it with your provider. So some key materials that are needed for an order of draw for venipuncture. You have your blood culture. These are different types of tests. Your blood cultures may be yellow top SBS tubes. Your sodium citrate tubes are your light blue tops. You need to know every one of these. Your serum tubes with or without separator gel or clot activator would be your mottled gray, your gold, your red, or your orange top tubes. Your heparin tubes or your green tops are all shades. Your EDTA tubes would be like your lavender, your pink, or your pearl white tubes. And then lastly are your oxalate tubes, and those are gray top tubes. You need to know every one of these. This is the order of draw for venipuncture. And we're going to talk about this explicitly in class. You will also be doing a presentation on this as well. When you're identifying additives to blood specimens and listing the order in which collection tubes must be filled or the order of draws, here are some factors you want to keep in mind. Cross-contamination is not a problem as if a multi-sample needle is not used. The composition of a capillary specimen changes through the collection, so first blood is more similar to arterial blood. Blood becomes more like venous blood as the collection continues, and platelet begins to collect at the puncture site as time passes, so making blood more likely to clump and less like the rest of the patient's blood. The order of draw for capillary puncture, guess what? You need to know this as well. Specimens to measure blood gases. This test is most often performed on arterial blood. But the first capillary blood can be similar to arterial blood. EDTA tubes, often used for complete blood count and should be filled before too many platelets collect. Tubes with other additives, and then serum tubes. You're going to see other videos about the order of draw for capillary punctures versus the order of draw for serum venipunctures. So one is coming through your vein and the other is coming through capillary. There's a different order of what tube you fill first or second and third. In understanding safety during the collection of blood specimens, you want to describe preparations that can be made before blood draw can help ensure safety. You want to ensure you have all of the equipment you need, as you saw in the video earlier. Ensure adequate supply of gloves. If transmission-based precautions are required, ensure all necessary PPE are present. Sharps receptacles should be nearby. Understand how safety mechanisms on the needle or the lancets work. And be mentally prepared for the blood draw and ready to respond to any challenges or adverse reactions. You should also know that the median cubital vein is the most commonly used vein for venipunctures for blood collection. is considered the first priority site for a venipuncture. And it's located right in the middle of your on the inside of your elbow, the antecubital fossa. And here is a picture of your antecubital veins. Your cephalic vein, if you look at your thumb side, your cephalic vein is always on the thumb side of your arm, on the outside. And your basilic is on the inside, closer to your body. And that median cubital vein is always in the middle. And today we're going to, or sometimes close to now, you're going to be looking at veins on each other. So you want to make sure you consider potential sites for venipunctures in this order. Median cubital vein would be your most commonly used. The second best vein location is usually the cephalic vein. And then lastly, the basilic. And so what I would say, basilic close to the body, B and B. Basilic close to the body. Cephalic is on the outside. Median cubital is in the middle. You're going to see a couple of videos later of actual venipuncture methods, and that will cover this information. For capillary blood collections, you're going to use the middle or ring finger of an adult's or child's non-dominant hand. You'll see this on your state exam, so you need to make sure you know this. In the side of an infant's heel, the side of an infant's heel. Those are places where you would do capillary punctures from to collect blood. Occasionally, the earlobes can be used. The earlobe and the big toe were once common sites for capillary collection. The earlobe is no longer considered appropriate. Okay, yeah, I was getting ready to say that we could, but yeah, the earlobe is no longer considered appropriate. The big toe may be used if better sites are not available. I've never seen either of these sites used in my lifetime of nursing. When you're selecting a place to do capillary punctures, these are things they want you to keep in mind. Fingers on the dominant hand are more likely to be calloused, so making puncture more difficult and painful. Index finger or second finger of either hand is more likely to be calloused and contains more nerve endings. Bones in the pinky are closer to the skin than bones in the other fingers. There is a pulse point in the thumb, so never use the thumb to do your capillary punctures. Patients who have frequent capillary punctures should have collection sites rotated. Finger stick collection is not appropriate for children under 6 months, so you don't do it. You don't stick the fingers of infants when they're 6 months of age, and those of any weighing less than 22 pounds. There is not enough flesh in their fingers to safely perform the procedure. The best area for performing a finger stick, the fleshy part near the tip toward either side of the third or fourth finger. That's what you need to know. Third or fourth finger. Not completely on the side, but more in the fleshy part of the hand. Not on the tip, because that can be sensitive. Points to consider when selecting a heel stick site. It's essential to avoid locations at which bone is very close to the surface of the skin. Striking the heel bone with the lancet can cause bone infections such as osteomyelitis. You need to know this. Striking the heel bone with the lancet can cause bone infection, and that's called osteomyelitis. The arch of the foot, bottom surface of the heel, and the very back of the heel must be avoided. Allowable sites are also medial and lateral plantar surfaces. You need to know that as well. A hematoma is an injury caused by leaked blood beneath the skin, and that can happen sometimes when you're doing a venous venipuncture stick. If there is injury to the blood vessel, it may swell up, and we call that a hematoma. and it looks pretty bad. It turns out it looks like a little goose egg, swells up above this, under the skin, but it causes it to swell. It looks like a little egg underneath their skin. Looks purplish and bluish, purple. Yeah, it's kind of like a bruised area. Well, for cleansing the site, you want to use 70% isopropyl alcohol pads, most commonly. Never blow or fan the cleaned site after you've cleaned it with the 70% alcohol. Other agents that can be used as an antiseptic agent, especially for blood cultures, would be a solution called chlorhexidine gluconate. You should know that. And if a person is allergic to alcohol, which you find very rarely, then you can use chlorhexidine gluconate to cleanse the area versus the alcohol. You can use iodine, may be used for blood cultures as well. Povidone iodine or antiseptic soap and water may be used when blood alcohol testing is performed. And the reason you would want to use this because you don't want to cleanse the skin with alcohol and then test them for alcohol because that could raise their alcohol level. So if you're testing them for alcohol levels, use povidone iodine or an antiseptic soap and water to cleanse the skin prior to drawing their blood. That's important to remember. We'll talk more about the angles for when you're doing a venipuncture. But angles higher than 30 degrees increase the risk of hitting an artery or a nerve. So venipuncture at a higher angle can also cause the needle to go straight through rather than into the vein. So we'll talk about the different angles that you should use when you're doing a venipuncture blood collection.
My name is Max Feinstein, and I'm an anesthesia resident at the Mount Sinai Hospital in New York City. And in this video, I have co-opted Dr. Schlossberg to lend me his right arm to show you how I tie a tourniquet. If you find this video interesting or helpful, I'd really appreciate it if you liked it and subscribed to the channel. Let's dive in. Placing a tourniquet can be used either for doing blood draws or, more commonly for me, placing an IV catheter. So the only thing that you need for the tourniquet placement itself is a pair of gloves and, of course, your tourniquet. If you will be placing an IV or doing a blood draw, then of course you'll need all relevant equipment for that. Tourniquets come in many shapes and sizes. This is what a standard rubber tourniquet looks like. Placing a tourniquet is actually a lot more nuanced than one might think. For one, you have to consider patient comfort. This is going to be tight, but you also want to make sure that the patient has any body hair, that you don't get that entrapped in the tourniquet. You also need to make sure that it's tight enough that you cause significant venous pooling in the patient's extremity so that you can actually get blood return in your catheter. And you also want to make sure that the tourniquet itself does not get in the way of the equipment that you're using, particularly the needle as it goes into the patient's skin. And you want to make sure that it's easy to release the tourniquet so that you can have a free hand available to manipulate other equipment as you're finishing up your IV placement or blood draw. With those goals in mind, the way that I start is by just placing the rubber band under the patient's arm, and in this case we'll be placing the tourniquet on the upper arm, and so you can see that it runs just behind his arm like this. With the tourniquet behind the patient's arm, I go ahead and reach across with my left hand and make this the back side of the tourniquet, and I secure it in my left hand with my 4th and 5th digit, just like this. That allows me to use the other strap and place it in between my thumb and my index finger using just my left hand. That allows me to keep my right hand free to manipulate equipment and also to adjust the tourniquet. You can see that it's very easy for me to tighten the tourniquet by pulling on the end that is closest to me. I simply pull up like this, and then I can maintain that tightness using my thumb and index finger on my left hand. Once I've gotten to the desired level of tightness, I can go ahead and tuck this in underneath this loop here using my right hand, and that maintains the level of tightness. I also want you to appreciate that that keeps both ends facing away from the area where I intend to do my venipuncture. I also want to point out that this strategy allows me to make a tourniquet as tight as I need to while maintaining space in between the tourniquet and the patient's arm so that body hair is not pulled tight, which can be very uncomfortable for patients. This particular strategy is very nice for a quick release. All that I need to do is pull a little bit on this end and the entire tourniquet undoes itself. This is what the whole process looks like start to finish. And now I'm ready to perform my IV placement or my blood draw. I'd highly recommend, as you're learning this technique, to practice it a number of times because it takes a lot of repetitions in order to get it without thinking about it too much. Here's what the entire process looks like slowed down so that you can practice it. If you enjoyed this video, you might want to check out this video where I go through all of the basic medications that are used as part of a general anesthetic. Thanks very much for watching. I'll see you next time.
Hey, this is Sarah with RegisteredNurseRN.com, and today I'm going to show you how to find a vein on your patient before you start an IV. Starting an IV takes skill, and one of the skills to help you be successful at it is to find a good vein that is viable that you're going to be able to stick first time and make it easier for the patient and for yourself. So in this video, I'm going to show you how to find veins. Typically in males are a little bit easier to find veins on, especially if they're healthier, because males' veins tend to be superficial and larger compared to a female. Females, unless they do cardiovascular exercise or an athlete, their veins are a little bit more covered with subcutaneous fat. So in a male, you're typically going to see larger veins. So this person I'm using is male, and he's healthy, so his veins are a lot easier to find. In the hospital setting, you're probably not going to have a patient with great veins like you're about to see here in a second. patients in the hospital are usually really sick, they're dehydrated, so their veins are going to be smaller and a little bit more difficult to find. So here we go, and I'm going to show you how to do that. Okay, first you'll want to tell the patient what you're doing, that you're going to be looking for a vein. You probably want to spend a minute or two trying to find a vein. And if you notice his veins, you can see them already without a tourniquet. Most people, you have to put the tourniquet on to get these veins to pop out. So here in a second, I'll put the tourniquet on. But notice you can already see his veins. So when you put the tourniquet on, tell them what you're doing. You're going to put the tourniquet on. And try to put the tourniquet on tight, but not too tight. And ask them if it's too tight. But you want it tight enough so it makes the blood pool in the lower extremity. And already these veins are starting to collect with blood and become engorged. 2 tips to help engorge the veins the best you can. Have the patient lower their arms so the blood pools down to the extremity. Next, have the patient pump their hand. This causes the blood to really pool. Okay? So they get nice and engorged, and compared to before, these veins have become more engorged. So I'm going to talk about the different areas that we typically start an IV on. You always like to use the hand or the arm. We very rarely go up into the shoulder or anything like that. That's usually on really patients who are hard to stick. Typically, the arm is sufficient enough. So first I want to talk about the antecubital area. This is the AC area. You may hear in the hospital setting the nurse say he has an 18 gauge in his right AC. So this is the AC area that they're talking about. Typically in the human, the veins are always in the same spot. So everyone should have the same veins in the same areas. They can be a little bit to the left or to the right, but generally they'll be in these areas. Right here is a vein. This is a very large, great vein. You could get an 18 gauge in this vein. There's a vein right here in the middle. I really like this vein. I normally use it a lot because it's in patients that I can easily find. I don't see this vein a lot, especially in females. I normally see this vein, so I stick that one. And then this one. This is another favorite one. People really like to draw blood out of this one too. A key, some people are seers. They can see the vein and they poke it. I'm a filler. I have to be able to feel the springiness of the vein. It tells me a lot about how, if the vein rolls, how large it is, and where the placement of it is. So if you're a filler, what you need to do is you need to take your index finger and always feel the vein. Veins have a unique feel to them. Compared to like if you're feeling the skin, it doesn't feel like a vein. So if you're new to starting IVs, I really recommend you practice on yourself with feeling your veins. Like put a tourniquet on and just feel your veins. Get a feeling for them, because once you understand how they feel, you'll know whether you're feeling a vein or not. That was the biggest thing whenever I was a student. I would always say, am I feeling a vein? Is that a vein? But now I know without a doubt, because I have it down so well of how a vein feels if it's a vein. So that's your AC region. Next region that people like to stick IVs in is the forearm. Typically the forearm is from here to here. So that's the forearm area. There's a lot of veins in the forearm. On this person, he has a really, really nice vein right here. It's very large, a little bit of a skinnier one right here, and then some more in this area. Typically people like to go in this area, but I have seen them on the top of the arm. Not a lot of people have superficial veins in the top of the arm, and then on the back of the arm too. There's some. If you have a man and he is hairy like this, you'll want to like shave it with not the straight blade, but just little clippers, and just trim the hair, so whenever you do get your IV, you can tape it down. Because I've seen a lot of times where you tape down the IV and the tape comes unloose within an hour or two and you lose your IV. So that's always disheartening when you lose an IV because you didn't tape it down right. So typically just clip the hairs on a male patient if they have long hair. Next is your hand. People really love to start IVs in the hand because the hand does not have a lot of fat in it, so they're really superficial and you can find them very well. So in this person, he has really nice hand veins, but a problem with the hand veins is when you start an IV, these veins like to roll. So let me give you some tips on how to prevent a rolling vein. First of all, whenever you're assessing your veins, you want to make sure it isn't a roller. How you can tell if a vein's a roller, you'll take your finger and just sort of mess with it. And whenever you mess with it, do you see how that vein right there likes to roll side to side? Okay, what's going to happen? If we didn't use this trick I'm going to show you, if I poked him with a needle, I would poke the skin. Whenever I poked it, it would go to the side like that, okay? And then your needle would go beside of the vein instead of in it. And then it would roll, you'd miss, and you'd have to try all over. So what you would do is you have the patient hold their hand, nice tight fist, and see, it keeps really, really tight. So whenever I stick him with the needle, it wouldn't roll. It's less likely to roll. So that's always a tip. Now, if you were starting it up in the forearm and it was a rolling vein, you could just keep it taut like that. Just do your hand out like that and keep it taut, and then poke it with a needle, and it should keep it from rolling. Sometimes veins are going to roll and it's just going to happen, but those are some little tips and tricks on how to prevent that. And then whenever you're done, of course, starting your IV, you'll pop the tourniquet off real fast, and then you're done. So that was just a little bit, some of the tips and tricks I've learned over my nursing career on how to find a vein. They've helped me throughout the year, and I've increased my success rate with starting IVs. I will be making a video on how to start IVs, so please check that out. And thank you so much for watching. And if you like this video, please share it and subscribe to my YouTube channel. And be sure to visit my website, registerednursern.com, for a bunch of nursing tips and anything to help with your nursing school. Thanks.
Purina puppy chow and kitten chow. Highly digestible with sensitive stomachs. DHA to help support healthy brain and vision. Nourish the now.
We're going to talk about the complete blood count, also known as a CBC. And as always, whenever you get done watching this YouTube video, you can access the free quiz that will test you on this content. So let's get started. For exams and as a nurse, you want to be familiar with this CBC because it's a very popular test that is ordered on a patient. Almost every patient that walks through those hospital doors is going to have a CBC. And why is that? Well, this blood test tells us generally how healthy this patient is. It tells us if they have an infection, maybe they have a hemorrhage, or they have anemia, or they have some type of blood cancer. And we can look at the results and help determine that. Now, how do we collect a CBC? Well, we stick the patient's vein and withdraw the blood sample from that vein. And it'll go into a tube, and then we'll send it to the lab, and the lab will run the complete blood count and then send you back the results. Now, for the NCLEX exam and your nursing lecture exams, what you want to know about the CBC is that you want to know what it covers, what those things represent that it covers, and those normal lab ranges that each part should fall within. And I have a whole video on labs that you want to know for the NCLEX exam that comes with the quiz. So if you're about to take the NCLEX exam, you may want to check that video out. And whenever you are answering these questions on an exam, the lab results that they're going to throw out at you are going to be noticeably abnormal. It's not going to be something that falls so close to that low part or that high part within that normal range, because labs really vary on what they consider normal. One lab may say a normal result is 12.5 to 20, while another one may say it's 15.5 to 20.5. So just know those ranges and know you're going to get something that you should be able to recognize if you already know the range that it's abnormal. And whenever you're working as a nurse and you're looking at that CBC result, you want to be able to identify, hey, if the platelet count is low, what's the patient at risk for? Or if this white blood count is high, what's going on with your patient? You want to be able to look at that. Also, whenever you get the results, which is pretty awesome, is that you'll have the result of the patient, but right beside of it will be the normal range of whatever that area should fall within, which is great because you already really need to know the normal range of white blood cells, red blood cells, hemoglobin, hematocrit, and platelets. But the CBC can get a little bit deeper. For instance, if you have a CBC with a differential, it's going to tell you the specific percentage or absolute counts of the 5 types of white blood cells, like the basophils, monocytes, neutrophils, lymphocytes. And you want to be able to look at that and say, okay, what did a basophil do again? What did a lymphocyte do again? Because that will give you a clue possibly what's going on with your patient. Also, the CBC can tell you about the...
What if a licensed clinician could meet you in the comfort of your own home?
Hi, Alexis from Signify Health. Nice to meet you.
Specifics about the red blood cell, like the red blood cell indices, which is going to go into depth about like the red blood cell size, the hemoglobin concentration, and things like that, which we're going to cover in this video. So whenever you're done watching this video and you go and you look at your patient's CBC, hopefully you'll be able to tell what an MCV is or an MCHC is. And if you were to look at a CBC result in the hospital on your patient, it would look something similar to this. Over here on the left-hand part, it says test name and has all those abbreviations of what is included. And this one is a CBC with a differential. So it looked really in depth at our white blood cell count. So you have WBCs, which is white blood cells, RBCs, which is red blood cell, and then HGB, which is hemoglobin, and HCT, which is hematocrit. And then it goes in depth into the red blood cell indices, which is the mean corpuscular volume, and then you have the mean corpuscular hemoglobin, which is MCH, and then you have MCHC, which is the mean corpuscular hemoglobin concentration, and then we have RDW, which is the red blood cell distribution width. Then we have PLT, which is platelet count. Then we have the MPV, which is the mean platelet volume. Then it's going to start going into the different types of white blood cells. And we have neutrophil percentage, and then the absolute neutrophil count, which is below that. And then LY with the percent sign is the lymphocytes, and then the absolute lymphocyte count, and then monocytes, and then the absolute monocytes, and then eosinophils, and then the absolute count of that, and then basophils, and then the absolute count of the basophil. And right beside of that, you have the patient's result. It gives you the units it was measured in, and then the normal lab range that I was talking about. So first, let's talk about the white blood cell count, WBCs. They play a huge role with infection, and depending on what's going on with the patient, we can look at the 5 different types of WBCs, and this can give us an idea of what may be causing the patient an issue. And a normal white blood cell count that you want to definitely remember is about 5,000 to 10,000. And anything less than 5,000 would be considered leukopenia. This is where you have a drop in the white blood cell count. Now, what can cause this? Well, there's various things, and some things that can cause it are like autoimmune conditions, medications like chemotherapy, drugs that suppress the immune system, and even some mental health drugs, along with severe illness like sepsis, cancer, HIV, AIDS. Now, you can also have on the flip side where the white blood cell count is elevated. That is known as leukocytosis. And what can increase the white blood count, of course, is infection, along with leukemia, extreme stress, and medications. Now, let's look at these and talk about these 5 types of white blood cells. Now, depending on the cell, they have various roles, and I would be familiar with the role of what each does. So the first one is the basophil. It plays a role in the inflammatory response and allergy response. And below each, you can see the average percentages of what should be in the blood that can just help you be familiar with it. And then we have the eosinophil, and this plays a role in the allergy response, like with asthma and parasitic infections. Then we have the monocyte, which plays a role with fighting infection and those foreign substances that may invade our body. Then we have the neutrophil, which plays a role in bacterial infections. And then lastly, we have the lymphocyte, which plays a role with viral infections. Next, the red blood cells, the RBCs. These are sometimes referred to as erythrocytes, or a really old term, red blood corpuscle. And the reason I want to include that term is because whenever we talk about the red blood cell indices, we're going to be talking about the MCH, the MCHCs, and so forth, and that is the mean corpuscular volume or the mean corpuscular hemoglobin concentration, and that's where that corpuscular word is coming from. We're talking about red blood cells, so hopefully that'll help you remember that. Now, a normal RBC count is 4.5 to 5.5 million. Now, if we have a low amount of RBCs, it's termed anemia. And there's various types of anemia, iron deficiency, we have pernicious anemia, so there's various causes, but we can look at that red blood cell indice and it can help the physician determine possibly what type of anemia is going on. In addition, other causes of anemia is acute blood loss, hemorrhage. A high red blood cell count would be termed polycythemia, and a cause of that could be like a blood cancer where that bone marrow is producing too many red blood cells. Now, also what they can read off of the red blood cell is the hemoglobin and the hematocrit, because the role of your red blood cell is to transport oxygen throughout the body and replenish your tissues with it. Then it's going to carry back carbon dioxide to the lungs so the lungs can exhale it. So hemoglobin is that protein that is found on the red blood cell that carries the oxygen, and it's short for HGB, and it differs for men and women, and I would know these ranges. For men, it's 14 to 18 grams per deciliter, and for women, it's 12 to 16 grams per deciliter. Then we have the hematocrit, short is HCT, and this is the amount of red blood cells compared to the total blood volume. And again, it differs for male and female. So for men, it's about 42 to 52%, and notice this is a percentage. And for women, it's 37 to 47%. Then we have the red blood cell indices. And indices, that word is a plural form for index. And this is going to tell us a little bit more about that red blood cell, specifically the size of the red blood cell and about that hemoglobin that is found on the red blood cell, which will help us determine if this patient has anemia and what type we are dealing with. So you will see a lab result on that CBC that says MCV. Again, that stands for mean corpuscular volume. This is the size of the red blood cell. And here in red, you can see the references for the normal ranges. Then we have the MCH. That stands for the mean corpuscular hemoglobin. This is the amount of hemoglobin that is in that red blood cell. Then we have the MCHC, that is the mean corpuscular hemoglobin concentration. And just as its name says, it's the concentration of hemoglobin in the red blood cell. And then we have the RDW. This is the red cell distribution width. And this is the amount of variation of the red blood cell's size. And lastly, we have the platelets, which is abbreviated as PLT. And platelets play a huge role in clotting. We need those whenever we're bleeding to stop the bleeding. A normal platelet count is about 150,000 to 400,000. And whenever a patient has a low platelet count, it's termed thrombocytopenia. And whenever a patient has this, they're at risk for bleeding. Some things that can cause this are like a bone marrow issue, chemotherapy agents, and viral infections. A high platelet count is termed thrombocytosis, and there is a risk for clotting. And some things that can cause this are like leukemia, inflammatory diseases, or acute blood loss. And also on the CBC, you can see a MPV. This stands for mean platelet volume. And this is just measuring the average size of the platelets. Okay, so that wraps up this review over the complete blood count. And don't forget to access the free quiz that will test you over this content.
Skincare can start in the laundry room. That's why I always recommend All Free Clear for sensitive skin. It's free of dyes and perfume.